Sickle cell anemia is a genetic blood disorder that affects the functionality and the shape of RBCs, and it is the most common and complex form of the sickle cell disease. Normally, the RBCs or the red blood cells are supposed to be round shaped or disc shaped, but in the case of sickle cell, they take a crescent shape or sickle shape. That is why it's called sickle cell anemia, because of the shape. And what causes sickle cell anemia? Something we call as HBB gene mutation. HBB stands for hemoglobin beta. Hemoglobin is a blood protein that is responsible for the distribution of oxygen in our body tissues and cells. And hemoglobin has 4 subunits. We have 2 alpha globins and 2 beta globins. For alpha it's called HBA, and for the beta it's called HBB. And we shall focus on the HBB because the HBB mutation is the one responsible for the sickle cell disease to sickle cell anemia. And I must also say that for you to have the sickle cell anemia, you must inherit 2 copies of HBB mutated genes, a single copy from one parent and a single copy from the other parent. That makes them 2 copies. And if you inherit 1 copy of HBB gene and another copy of HBB mutated gene, you get the sickle cell trait. You are a carrier. But if you inherit 2 copies of HBB mutated genes, you get the sickle cell disease. Now, when we talked about DNA, we talked about a process called sequencing. And this is when this nitrogenous basis tries to form in a specific series, in a specific sequences, the codons. Now we have GAG. A very slight difference, variation causes the whole disease mechanism. Now the sickle cell disease. We have GAG. This is a codon, guanine, adenine, guanine. That's a specific sequence. This is a codon. GAG is a codon. It changes from GAG to GTG, guanine, diamine, guanine. And this light change is the one that's responsible for this whole sickle cell disease. The change from GAG to GTG in DNA sequencing is the one that causes the sickle cell disease. Now this variation, this GAG to GTG, we call it HBS, hemoglobin S. And now we have HBS. And in low oxygen condition, this HBS polymerizes. They stick together, forming long strands, long chains. And now this is happening where we have the RBC. The RBCs, which at this point are in their normal shape, the round shape. And now this is inside the veins or the arteries. And now, because there is the introduction of the HBS, the RBCs now will be distorted because they must make room for this HBS. And in the process, they end up breaking, blocking the veins. Now, when there is the blockage is when these people with sickle cell anemia experience the crisis, the painful periods. Is it the painful episodes? Yeah, the painful episode, the crisis, because there's blockage. And also, when there's blockage, this means there's poor supply of oxygen in the tissues and cells, so they will be weak. They appear weak, maybe physique. That is why people with anemia, with sickle cell anemia, have weak physiques, immune system, and everything because of this oxygen thing. Now, when they now distort, they polymerizes, they stick together to form these long chains, and now they go to distort the RBCs. Now the RBCs will now try to make room for the HBS. They take the crescent shape, they end up breaking. When they break, that means there's low RBC count, there's low RBC in the body. And what does low RBC means? It means anemia. And what type of anemia is this? Sickle cell anemia, because at this point we already know that our RBCs, now the RBCs we have are already in the sickle shape. That is how sickle cell anemia comes, the mutation in the HBB gene. And that is why in most cases these people, they need to hydrate, they need to not be so vigorous in terms of exercising, and some of the signs and symptoms they show is poor vision. We have swelling of hands and feet. We have things like painful episodes, the crisis. We have, those are some of the signs. Weak physics, immune system, and everything. Weight losses, loss of appetite, all those are what people with sickle cell anemia show. We have management, we have treatment, we have painkillers, pain management, we have medication like we have some specific medications for the management of the crisis. We also have bone marrow transplant, stem cell, but this is just a potential cure. We have blood transfusions. Those are some of the treatment methods. Also, we have ways of diagnosing. In some countries, they have newborn screening. Not all countries. In some countries, we have a test called hemoglobin electrophoresis. This will diagnose sickle cell anemia. And some of the risk that sickle cell anemia has, it can cause stroke, organ damage, things like pulmonary hypertension, all these vision problems. Those are some of the things that sickle cell anemia can cause. That is basically how sickle cell anemia comes. It's a hereditary condition. We must inherit these 2 copies of HBB mutated gene, and that is basically how sickle cell anemia forms or comes in our bodies. In case you ever have a question, don't fail to ask your doctor. And for more health tips, please follow.